So in putting this meeting together, we developed a bit of a theme. It was our annual report. The Healthcare Coalition works on a June through July timeline each year, and so does the Department of Health and some of our other partners. And so when we were putting this together, we're like, it's our annual report. And Michael had delivered some similar content at the Washington State Hospital Association conference last summer, which we'll put another plug in for. It's a fantastic conference, and it's probably as close to really being on point for the content we discuss here on a regular basis. And so if you have anybody in your organizations that are looking to attend, it's a free conference. It's in Wenatchee next year. It's well worth your energy and time. But when we were putting this presentation together, we couldn't think of a better context from which to tell our story as a coalition than to parlay it out of the work that DOH has been doing. It's really an exceptional amount of change the Department of Health has initiated. And so, Michael, thank you for coming to share your story with us and share some of the exceptional work this department is doing. So our organization, we also have some other partners following us. And so the theme of kind of annual reports and coalition updates will continue through the meeting. We're going to have some reports after us from Idaho and Oregon, which I'm really excited to hear. And then we're going to take a left turn back to where we were last meeting with a follow-up update on Cascadia Rising from our previous presentation. So our annual report, I've been told two things in preparing for this, is that one, this is very different than the reports that have been provided in the past, and so I'm looking forward to your feedback. But then two, I should slow down. So hopefully my illness today will get me in that trajectory. But we've got two components to the update I'll provide today. One is a little look back on the last year, but then it so happens that parlay, it just translates really well into the last couple months worth of work and where we're going from here. So we'll take a moment to recognize that break, but it really is two pieces to our annual report this year. One of the things we're most proud of this last year is the transition in staffing, and this is a theme that will reemerge later in the presentation. We have Erica Henry, who did 4 great years worth of work with us in the Regional Healthcare Coalition as our first employee, really set a foundation and standard for us to build from. And I think one of the things that we're really hoping to not underappreciate is that with a staff person of one, with a lot of institutional knowledge and experience, translating that into the next evolution or the next group coming in was not an easy task. This article is from our December newsletter, and I'm not asking you to read it, but know that we hope that we've been here and been able to maintain contact with all of our regional partners, all of our healthcare partners, our behavioral health partners, our public health partners, and maintain the functions of the coalition. I think with an organization like ours that is still developing and evolving, it's a place where it can easily falter, but I'm pretty proud that we've been able to maintain a lot of our services. When I arrived, the coalition had just taken a tremendous amount of feedback from its membership and created a strategic planning document with the help of the National Healthcare Resource Code, NHCRC. Acronyms get the best of me sometimes. But this strategic planning document was created in June of 2014, and I think it was in the September meeting we actually provided a nice presentation on it. So it's a good time to provide a little update. The document was really driven from member feedback and gave us an insight to what our coalition members were looking for and what we could do to evolve as an organization to better serve our region. The report really had 2 primary focuses that came out of it. One is one of the reasons that I'm here today, was a real focus on sustainability. Michael mentioned some of the changes in funding over the past several years, and the reality is that the hospital preparedness program as a single funding source is not something that would meet the needs of our coalition over time. We knew that disasters change our funding levels up and down, and we know that we can't be here every year relying on a single funding source. And so sustainability was definitely a priority to make sure that the coalition and the work we do is something we can maintain even if there isn't a disaster that, or a pandemic or whatever it may be that we're responding to. That we're able to meet the region's needs and really focus on what our membership is asking for. Updates. So the strategic plan really has laid out a tremendous guidance document for us going forward, and is something we continually refer to on a regular basis. The other component out of this document that was really important for us to recognize is the coalition had been meditating on this idea of response, or what can we do? As you all know, there's 4 components to the response cycle. There's planning, response, recovery, and mitigation. And the organization for about 10 years had really been focused on planning. We've done a lot of work, a lot of coordination, and laid an incredible groundwork. But one of the things that we've been really thinking about going into this was, what does it mean to respond? How do we evolve the organization to that next tier to really help reach out and provide assistance? Our initial efforts from that really focused on this Emergency Support Function 8. A lot of you know this from the NIMS model, that there's 15 priority emergency support functions. And ESF 8 is public health and medical. And it gave us a framework to really understand how we might fit in. And for those of you that aren't familiar with what an EOC is, Emergency Operations Center, like Michael mentioned, this is an EOC that we simulated down in Pullman, Washington this year. We were lucky enough to be invited down to an integrated emergency management course that was hosted by WSU, Pullman, the city of Pullman, and Whitman County. Thank you, Laura. And as you see, Laura Barrett in the audience is in the upper photo there, along with Mike Baker and Bruce Haley, who's here somewhere as well. And the group of us were sitting there acting in an ESF 8 desk. We were there to be able to take calls as needed throughout the event and respond with resources that would be able to help resolve those needs, essentially. So an ESF 8 response, and this, if you ever get a chance, this is a quick plug for FEMA. This Integrated Emergency Management course is a FEMA-based training that came to this local community and really focused on bringing together 3 organizations that ultimately rely on each other for support and coordination. It's a tremendous, tremendous opportunity to get to know everybody down there, and I was really, really grateful for the chance to learn and grow with that community, because I have much stronger bonds and appreciation for the work these people do in their homes. But FEMA does a great job, and there's a lot of great opportunities out there. So consider FEMA training as part of what your organization looks at. There's a lot of free courses that have outstanding quality of education available. So we were looking at this Emergency Support Function 8 as a coalition in response. And we had really thought that this is where a lot of our energy would be. To be able to get there, we had spent a lot of time back in 2012 and 13 thinking about emergency medical staffing and thinking about resources within our region. We started off with a medical resource inventory in 2012, I believe, and followed up with several seminars on emergency medical staffing in the following years. It came to the evolutionary point where we realized to be able to really meaningfully support an ESF 8 function, we would need to be able to train volunteers quickly and provide them with tools to be able to do their job in that function of connecting resource needs with the resources that are available in the community. So this ESF 8 resource index document was created thanks to the help of Erica Henry, who got a lot of the foundation done, and Elena Mira here was acting as an intern for SRHD at the time and able to finish this up in 2014. We're quite proud of it in the sense that its format is a little different than a traditional ESF 8 resource manual. A lot of our ESF 8 manuals are a compendium of plans. They're quite thick. They're difficult to navigate, but they're quite comprehensive. This approach really allowed us to look at the manual in a different way and create a very concise directory that takes content and pulls synonyms together so the person manning the desk doesn't need a lot of education. They can respond quickly to the calls coming in and be connected to a root topic and then be able to provide meaningful content back out to the caller or to the people in the EOC looking for information. So we can do quick training with just-in-time education. We can do easy updates and maintenance, so it wouldn't be a burdensome document for us to carry forward in the long term. And it allows a lot of flexibility in how we evolve the document over time. So we're quite proud of the work we did on the ESF 8 manual and continue to do training for that in the next year. So ESF 8 was where we thought we would be responding, and certainly in events like OSO, like Michael mentioned, and some other examples from the state of Washington, the ESF 8 capability was something that we really thought would be a relevant place for the coalition to step in. On September 29th, 2014, Thomas Duncan came to the USA, and Ebola became a national priority. And quickly, we learned that there might be some other opportunities beyond ESF 8 for us to be able to act in some kind of a response function. Again, evolving that concept from just planning to providing services back out to the region as needed. When Thomas Duncan came to the USA, Ebola became a huge priority. And as you all recall, there was a series of evolving guidance documents from the CDC, both about clinical standards for PPE, but also about how to develop and manage statewide structures to be able to deal with this need for isolation, quarantine, and information. The coalition was getting all this information from the national audience, like all of us were. We were working with great support and guidance from the state of Washington, who really stepped into a very proactive role with it and helped lead the state to create the frontline assessment and treatment structure that we work within today, and really helped develop and push forward the Identify, Isolate, and Inform protocols. But to get to that point, we realized there was a lot of information available at a state level, at a national level, but locally, we weren't always talking to each other. And what we were really grateful, early on we received a Ebola response plan from one of our local hospitals. We got that, and it was this incredibly magical document because we hadn't seen a lot from the CDC at that time, and things were still evolving and changing. And we realized this is really valuable. How can we share this out? Who can we give this to, and who can we work with? And with permission, we shared it out in small little doses and realized that this local sharing of information really needed to be facilitated, and it was something we could definitely facilitate as an organization. It was timely, it was relevant, and it was something we could do. We didn't have a great structure to do it, and we knew there was a lot more to it, but it kind of shifted our thinking a little bit beyond just response being ESF8, but being more about information sharing. And in this case, it was what the regional organizations were doing before we were complying with state or national documentation. We continued that process of information sharing through the Ebola response. It was a really great experience working with a lot of facilities, everything from hospitals, frontline and treatment facilities, Providence, Sacred Heart being notable, which I'll talk about in a minute. But also we got calls from clinics and outpatient surgery centers, places that we never had contacted before as a coalition. We really realized that information sharing and being able to take the knowledge from national and state examples and push it back out was something we could do locally, meaningfully. This culminated in September 23rd when we had our Ebola Symposium, and we brought national speakers like Scott Bourne from AMR, Peg Curry and Mary Jo Moore from Providence Sacred Heart shared some of the story of why Providence would step up and take this responsibility on at a time when Texas Presbyterian was struggling financially after bringing Thomastown into their facility. We had Scott Lindquist from the Department of Health come and speak and share some of the epidemiology perspective on the disease and what it meant nationally. And we were able to bring a lot of the knowledge that was developed locally over the past previous several months and share it back out. It's still available by webinar. Please take a look at our website, srhd.com/HCC. We have a ton of content on there, including all our recordings. This will be recorded and available there if you want to push it back out. But it really became a useful tool for us to share information throughout the region. Once we thought Ebola was kind of under wraps, we all went home for Christmas, and we did Christmas, and then I put away my Christmas tree in December, and all the lights of, has anybody worked with WATRAC users? Anybody? There's a couple in the audience. WATRAC is a statewide bed tracking tool, and it has status updates from different hospitals. And red, yellow, green, and black and white are the status colors for the agencies. When you look at a regional status picture, you see these colors on WATRAC. So I put my Christmas tree away. I thought the Christmas lights were done, but then I came into work in January, and all of a sudden WATRAC lit up like a Christmas tree. It was red and yellow and colors that it shouldn't be. And that happened again and again and again, day after day. And what you're seeing behind me is a spike that we haven't seen in a while, and it was an incredible flu season in January and February. It was a season that pushed all of our ICUs to capacity, and our emergency departments were on divert on a regular basis, both in Spokane County, but around the rest of the state as well. King County was feeling similar pressures, and the system was definitely under strain. Public Health created this wonderful graph and did exactly what they should do, which is really focus on the epidemiology side of things, and got a lot of great information out. They were talking about prevention and talking about all of the issues that go along with a heavy flu season. But what was an opportunity that we found was, again, healthcare-specific information sharing. We were watching WATRAC light up like a light bulb, and as much as the public knew it was a heavy influenza season, there was still a lot of information yet to be shared amongst healthcare partners about what was happening around the region. Our rural partners, for example, didn't know the severity of which Spokane was being inundated by influenza patients. And vice versa, Spokane wasn't alerted that King County was available for, was limited on its availability for similar reasons. So transporting a burn victim over to Harborview, not always the easiest thing to do at this time of the year. What this brought to us was an opportunity to kind of reach out. We touched base with our emergency departments in Spokane, got a sense of what was going on, and started to gather some information. And again, we realized that the opportunity for us to support our partners wasn't so much in this formalized EOC, Emergency Operations Center, crisis-only mode. It really was under the structure of providing awareness of what's going on with context deeper than what's available through the regular tools. So being able to reach out to our partners, gain trusted information in a timely way, and bring it together and share it back out became something of a theme from Ebola and into the influenza season. We started to develop a bit of a reflex when Colville had a windstorm up this June or July, I can't remember the date. We went ahead and called. We checked in and said, hey, thankfully, everything was fine, but we found out that a lot of employees weren't able to report to work. And it was because they had some damage up there, not to their healthcare facilities, but just because the roads were closed for a while. And so what we started to develop was a bit of a reflex in the organization about how we reach out and how we communicate with partners. We did a lot of other things in the last year, too. We worked with DOH on a statewide agreement between Deaconess and Harborview for a Disaster Medical Coordination Center program. We provided trainings without our region. We brought a lot of great content to our organization through meetings like this. We had great information about active shooter events in the community and how Rockwood Clinic provided an amazing prevention program to try and mitigate that in the future through domestic violence education. We had great information in these halls about, I can't remember any others off the top of my head, but it was a heavy year of content that we brought back to the region. But that theme of response didn't end in 2014. So as we transition in 2015, I'm going to keep going. Any questions about the last year? There'll be time at the end as well. It continued on, and we had a Zodiac aircraft explosion up in Newport, Washington that activated a communication with our Disaster Medical Coordination Center. This is one of the first times that we've seen DMCC activated in any capacity in a while. Thankfully, our region is very low on the hazards we experience, but in 2 months, we had 2 DMCC notifications. In the second capacity, Deaconess Hospital acted as a patient placement tool throughout Spokane County to make sure patients were moved appropriately and placed throughout the region. From both experiences, these were shorter duration events, but it was clear that there was a need for information even in this capacity. We weren't able to support or provide much as a coalition, but we realized that information sharing is still a priority throughout the region. I bring this up because it just highlights some of the work we've done in the past around coordinating the Disaster Medical Coordination Center program and helping facilitate its development over time. It's certainly a priority going forward and something we're going to continue to work on in 2015-16. Situational awareness really became formalized for us when the wildfires struck. You're seeing the North Star fire, and right here is Republic, Washington. It's not a far distance, just about 6 miles or less between Republic and the fire lines on the North Star fire. At the time that level 2 evacuation notices were issued for Republic, Washington, Spokane County also got hit with tremendous smoke particulate from the Carpenter Road fire nearby. That really brought public health awareness to the air quality issues around providing health care in the region. And so we started reaching out by phone and continuing the theme that we developed in 2014, really focused on that response capacity, and started to reach out to our healthcare providers and gain context about what they needed. We started asking questions about their staffing, if they projected staffing deficiencies, if there were any changes to their level of service they were providing or anticipated level of service changes. Checking to see if there were any specific resources that we could provide as a region that we could help coordinate or reach out to help maintain their level of readiness and operation. And we pushed these reports out, again, not intended for you to read. They're available should you request them. But for about 17 days during the state's highest smoke levels in our region at least, we reached out to our Northern County partner hospitals and Southern County hospitals that might be affected by wildfire smoke and checked in on their operational status. And we learned a lot, and it provided a lot of information beyond what WATRAC is providing on a daily or hourly basis. So the response capacity of the coalition really became evident as incredibly valuable, and it's been something that we've, coming out of our strategic plan in 2014, are really proud to start to develop. So I'm going to talk a little bit more about what we're doing. But one of the ways we started working on the formalizing how we do that body of work around situational awareness is this Healthcare System Operational Response Committee we formed. I'll talk about that as well as our upcoming Disaster Clinical Advisory Committee and our patient tracking project for the next year. Is 3 little priority projects we've got going. So the wildfire briefings were a good first step, and they were something that we put out in response and in reaction to a necessary need. And it's something that we feel we did an okay job with, but there was a lot to formalize. We had a lot of on-the-fly education with our healthcare partners, both about what we needed and what they could expect from us. So before wildfires ever came along, a lot of this was in process already, and there's a number of people in the audience who are Healthcare System Operational Response Committee members. People who have been coming together to help advise the coalition on defining what this response capacity could be for the coalition, helping us understand how we can help serve that second piece of the response cycle to a crisis event. And so show of hands, HSORC members in the audience. I think there's a few. 1, 2, 3, 4. Fantastic. Thank you. If you have any questions about the committee or the work we've been doing, please reach out to them. But our intent with this committee is to formalize and develop structures for the coalition to continue services like this and be able to do it with good, accurate, and timely information that we can trust and being able to push it back out to people that need to know critical information. One of the other projects we're excited to be working on this next year is creating a concept of operations around patient tracking. I talked earlier about the Pacific Steel and Recycling event that happened here in Spokane, Washington. It was one of our largest MCIs that I've heard about in quite a while, and it had patients placed at all 4 hospitals. I don't think I've heard of anybody who has a single collective list of patients or names, and I think it really exemplifies exactly what we're trying to achieve with patient tracking. I know it's been something that this region's talked about for quite a while, and we're delighted to have a tool that we can help work on to develop some structures to implement in Region 9. We have a long way to go with it, but we believe we've got a committee with the right people, both from EMS as well as hospitals, to help figure out how and when we'll start to utilize and implement patient tracking in the region. The third major area of focus for us in the next year is really talking about crisis standards of care. It's a discussion that's been happening very successfully in the King County region and now at the state level. The project really, for a lot of us, has been driven by the Institute of Medicine 2012 document that creates a good framework for discussing shortages of vaccines, shortages of supplies, how you prioritize patients, really looking at what to do in a medical situation or a disaster situation as a medical provider. King County created what's called a Disaster Clinical Advisory Committee and successfully brought together a number of clinicians and healthcare professionals to discuss these issues both from an ethical perspective, a legal perspective, and a practical perspective based on the examples we've got nationally. That conversation has been incredibly fruitful there, and the state of Washington developed a Disaster Medical Advisory Committee structure that'll be feeding from that and other committees like what we are forming in Spokane, Washington. So Spokane County is planning on developing a similar discussion and dialogue to help inform our practitioners about best practices when it comes to crisis standards and how their decisions during that time can be most effective. So we've got those components along with our regular body of work that we're continuing on a regular basis. So it's a pretty exciting year for us. We've got some great new projects, but also maintaining and continuing a lot of the work we've been doing. A lot of you know that we've been a staff person of 1, and we were excited to complete that staffing transition this year. But there's a question of how are we going to do some of that work. And one of the things I'm excited to do during this presentation is introduce some new members to the coalition. Well, but I'll do that in a minute. Thanks. But don't forget to fill out your survey. We are taking feedback on our member satisfaction survey. We have some hard copies at the door, but then we've also been sending out electronic links. We've done this every 2 years, and we've got another version out now. We look forward to getting your feedback about how we can best serve you as a region and as members of the coalition. Also note that we've got some upcoming regional visits coming. I took this photo when I was down driving back from Columbia County one day, and it's a dead end for me out there if we don't have our partners during these visits and during all the work we do. So thank you to everybody who contributes to the coalition on a regular and frequent basis. All right, now I can introduce new members. I'm really excited about this. But we've got some new team members joining me at the coalition, which I'm pretty excited about. As you know, I came to the coalition with a focus on maintaining the services we provide, finding opportunities for the coalition to serve the region, and develop some planned sustainability. That's exactly what I'm here to do and can continue to do. We have, you want to join me, Elena and Ryan? You want to come on up and we'll do introductions. So around the bodies of work that we've got going forward, I'd like to introduce Elena Mira.
Hello, everyone. Thank you for coming. My name is Elena Mira, and I'm the Region 9 Healthcare Coalition Support Specialist. And I'll be doing a lot of the logistics and quality control.
Elena is she was an intern at Spokane Regional Health District before this, and as you saw, she completed our ESF8 manual, and in a short body of time, I think she had probably 2 weeks to work with me on that project, came in and learned essentially everything in the ESF8 manual, its context and how to apply it, and brought it to completion. So we're incredibly grateful to have her with us. She's joining us in a half-time position, half of her time with our Region 9 Healthcare Coalition, half her time with the Immunization Action Coalition. So we're excited to really have her to provide some consistency and glue to the work we do. So next, I'd like to introduce Ryan.
Hi, everybody. I'm Ryan Traylor.
I don't know if it's on. No. No.
So I'm Ryan Traylor, and I'm the new Communications Outreach Specialist for the Region 9 Healthcare Coalition, and I'll be working on developing regular communications from the coalition to all of you.
So similarly, Ryan came on board, and I had this stack of documents, all the capabilities documents from FEP, as well as the ASPR documents for capabilities, a number of historical reports, strategic planning report, and I mean, it was a stack of paper like this. I think Ryan read through it in about 2 days, and so she's already challenged me for more. So I'm really excited to have both of these staff members joining me. Thank you both for coming up. Yeah. The other good news is that although we've got some new faces joining us, the familiar faces are still with us. And so Susan's going to be continuing forward as our administrator. And Ed, unfortunately, couldn't be here due to some family concerns, but he's continuing on as the coalition chair and will continue to be an active and vital part of the organization. So any questions? That's it. Any questions on last year and what we're doing this year?
Hello, my name is Bill Joseph. I'm with the Colville Tribes. He gave a very good presentation, very comprehensive, but the Colville Tribes just went through a heck of a month of fires, and all these reports sound really nice and everything, but when shit's really hitting the fan, the region's there for you, the state's there for you. And I try to come up with a more eloquent way to say it, but we were really desperate, and they were there for us. But the big message is, if you don't think it's going to happen to your jurisdiction, I don't know where most of you people are, your hospital, please think again. You got to prepare, come to all these meetings, the exercises, everything, because when it hit the fan on the reservation, I knew I was going to need state help like right off the bat. The tribe enjoys having a tribal liaison. She was there within hours of my calling. She helped coordinate with the regions, Susan and Mary Small from Region 7, because our reservation is big enough to be on 2 separate regions, which sounds good, but sometimes it's more of a hassle than you think. But so please get to know your regional coordinators. If you don't know Susan on a first name basis, you need to get to know her. And then whoever your state, like I said, the tribes has a liaison, and I don't know who it is for off reservation. Maybe Michael could tell you, but you need to form those partnerships, because when it hits the fan, don't kid yourself, it is going to hit the fan, and you need to know these people to give yourself help, your people, your clients help. One of the first slides that Michael put up was safeguard the lives of, what was it, Michael? Some about saving lives, right? And that's what it's all about. The Colville Tribes was under the gun for 13 days. And in Region 7, every hospital in Okanagan County was either under a level 2 or 3. What are you going to do when that happens at your hospital? A lot of assisted care living was evacuated, including the ones for the Colville Tribes. So get to know the key people that can help you the most, because it certainly helped us. So that's just all I wanted to say. Thank you.